Welcome to RN Osce learning sessions. Today we will go through Station 10, Managing Deteriorating Patient and Updated Version. Let's start by reading the scenario carefully for 2 minutes. Here you are working in a medical ward, morning shift. A patient name, age, ethnicity is so and so. She is admitted for gastric ulcer treatment and was on omeprazole infusion and planned to be discharged at 2 p.m. today. She rings a call bell as she is feeling unwell. She has no history of comorbidities. Her vital signs were stable. However, she now reports feeling unwell. Upon assessment, you noticed a sudden variation in her vital signs and continues to report discomfort in the chest, and her condition deteriorates further. Our recommendations are: you have to call on-call doctor and request to review immediately as her treating doctor on leave. Discuss the potential causes or reversible causes. As always, knock the door before entering the room, ensure scene safety, provide privacy to the patient, and perform hand hygiene. Here, as it is a conscious patient, we follow ABCDE assessment. It's a systematic approach used in emergency and critical care settings to evaluate and manage critically ill patients. It helps to prioritize life-threatening conditions and guide immediate treatment. While assessing the airway, you have to look for the airway is open and clear. You have to look for the obstructions like blood, vomit, and any mucus present or not. While assessing the breathing pattern, is the patient breathe adequately? And you have to assess for any signs of respiratory distress or cyanosis. In the circulatory status, check the patient's pulse rate, rhythm, blood pressure, and capillary refill as well. And look for signs of instability. That's coming up next. D stands for disability. Assess the level of consciousness by assessing the alertness, response to voice, pain, and unresponsiveness. You have to check. Consider the blood glucose level also. Assessing the disability by checking the level of consciousness by alert, response to voice, response to a painful stimuli, and unresponsiveness. And also consider blood glucose check. E stands for exposure. You have to identify any hidden injuries, inspect the back, log roll if any trauma if you are suspected. E stands for exposure. You have to identify any hidden injuries, including any bleeding. Inspect the back, log roll if any trauma if you are suspecting. Moving further, we can identify that a patient is clinically unstable by observing for altered sensorium. For example, any confusion, any reduced responsiveness, and any complaints of chest discomfort, for example, heaviness or pain in the chest, and feeling unwell. Features suggestive of any heart failure, for example, any breathlessness, bilateral leg swelling, signs of shock, that means cool calming extremity, rapid and weak pulse, that's the signs of shock, or any sudden drop in blood pressure, systolic BP falling below 90 mm of mercury. These are the 5 signs of instability. The presence of even one of these signs is enough to consider the patient is clinically unstable, whether it's a bradycardia or a tachycardia. Okay, let's see. Hello, good morning. I'm your nurse in this shift. How are you feeling today? I received a call bell now. Do you have any discomfort or any concerns? Yes, nurse, I'm not feeling good. Or I feel some kind of uneasiness, but no pain in the chest right now. I heard that you have this uneasiness in the chest. I'm here to assess you further. Before moving further, could you please tell me your identification, your name and date of birth, please? Okay, thank you for sharing your information. Moving further, okay, could you please tell me more about how are you feeling now? Do you have any breathing trouble or any breathing difficulty? Yes, nurse, I'm not feeling good and I feel some kind of suffocation. I feel little bit dizzy too. I heard that you feel dizzy. It's better to be lie down and I will keep your head and little bit elevated. Is that okay for you? Okay. Let me assess your vital signs, including your blood pressure, heart rate, respiratory rate, and oxygen level in the blood too. Okay. Your BP is so and so, heart rate is, respiratory rate is, and saturation. Your heart rate is so and so, everything within normal limit. So you have done this assessment. Okay. Continue your assessment by asking, do you have any other difficulties unless feeling dizzy and unwell? Or does it work? Yes, nurse, I'm not feeling good. What's happening to me? Okay, I'm here to monitor you. Let me recheck your pulse and blood pressure now. Okay, your BP is, your heart rate is, and your heart rate is dropping from the normal limit again. Okay. Okay, as your heart rate is still in lower side, I suspect bradycardia. Let me obtain a 12-lead ECG. I would prefer to obtain an average reading before notifying your doctor to better assess the level of urgency. Is that okay for you? Okay. Is it okay if I touch you right now? Okay. Okay, I can feel your extremities are cool and calmy. Okay, that indicates you are in shock. And your ECG shows brady features. I'm looking for any PR prolongation, dropping any QRS complex. Okay, I'm going to inform your condition to your treating doctor. Is that okay for you? Okay. Hello, I'm so and so calling from medical ward. May I know who is this? Yes, I am so and so on call duty today. Okay, doctor, I am calling with regards of my patient so and so. She got admitted here due to peptic ulcer and she was on omeprazole infusion and was planned to get discharged today at 2 p.m. But today around so and so I received a call bell from her and complaining of feeling unwell and dizzy. Upon assessment, her BP is, heart rate, respiratory rate, saturation is so and so. I reassessed her vital signs after few minutes and found that her heart rate is dropping down and complaints of breathing difficulty or suffocation in the chest, for which I obtained a 12-lead ECG for further clarification. I suspect it's asymptomatic brady features. I checked for any signs of instability. She is having hypotension and in shock. Could you please come and assess her right now? Okay, I'm coming. Meanwhile, you monitor and observe her. Thank you, doctor. Once you've done the assessment, you have to escalate the concern as early as possible. Even it's a bradycardia or a tachycardia, you have to follow ABCDE assessment as the patient is conscious. And your initial interventions begin by ensure the patient can breathe properly and continuously track the heart rhythm. Prepare for possible medication administration, for which you have to establish an IV access. obtain a crash cart as early as possible, and prepare for pacing if the patient is in brady. And always get ready with atropine as it is a first line drug to increase the heart rate if the patient is symptomatic. And don't forget to inform the consulting doctor or keep the expert consultation, like involve a cardiologist or a critical care specialist as needed. And if the patient is having fast heart rate, that is tachycardia, as always you have to begin the airway, breathing, circulation, disability and exposure assessment. Moving further, you have to begin with initial interventions like ensure the patients can breathe properly, continuously track the heart rhythm, prepare for possible medication administration. For that, we have to establish an IVSS, obtain a crash cart, prepare for synchronized cardioversion, and consider adenosine as the first line drug. For further action, obtain a crash cart and prepare for any emergencies. If the patient is unstable, like if the patient shows any hypotension, any altered mental status, you have to apply shock in sync with ECG. And you can consider adenosine for certain types of narrow complex tachycardias, and always escalate the concern as early as possible. Okay, once you escalate the concern, the doctor may ask you that what do you think? What may be the possible causes? Or what may be the reversible causes of this particular condition? If you are asked about reversible causes during the management of bradycardia or tachycardia, you can mention H's and T's, which are the most common reversible causes of arrhythmias. Hypovolemia, low blood volume. As you all know, low blood volume, low oxygen level, any changes in the metabolic or respiratory H's include low blood volume, that is hypovolemia, hypoxia, low oxygen level, hydrogen ions, any metabolic or respiratory acidosis can lead to, hypo or hyperkalemia, any abnormal potassium levels, low blood pressure, that is hypothermia, collapsed lung, drug overdose or poisoning, fluid around the heart that is compressing it, that is cardiac tamponade, collapsed lung with pressure shift, that is tension pneumothorax, any thrombus, that may be the pulmonary or coronary thrombus, and finally any trauma that can lead to the patient unstable. So these all are the possible causes or reversible causes you should answer. Regardless of the scenario, if the patient is conscious with brady or tachycardia, begin with a primary assessment by using ABCDE approach and address any reversible causes.